Hello everyone, Vanakkam and welcome to Meteor Nursing Academy, one of the leading academy in training nurses in their nursing competitive exam as well as IELTS and OET training. Today we are going to continue with the JIPMER question paper 2022 along with the answer key and full rationale and explanation for all the four options. Actually this is part 2. Part 1 is already there in the Meteor Nursing Academy YouTube channel. You can go and watch the video there. So in this also we are going to explain in detail about all the questions. Please watch the video fully, and if you like this video, please like it, share it, subscribe it, and don't forget to click on the bell icon. If you want to follow us, please follow us in Meteor Nursing Academy YouTube channel. Now we are going to see about the causative agent of endocarditis, and they have given four options: Streptococcus, E. coli, Pseudomonas, Klebsiella. So when you come across these words, especially endocarditis, all the golden points should come into your mind. What are all those golden points? Let's start the golden point with the layers of the heart. There are three layers of the heart, that is pericardium, myocardium, endocardium, and endocardium is the innermost layer of the heart. So this area is getting affected. So pericardium, myocardium, endocardium is the innermost layer. This area is affected and getting infected. This is called as endocarditis. So which organism is most commonly causing this endocarditis? That is the question here. Okay, so what do you think? Which organism is going to cause endocarditis? The first very important organism which is going to cause 50 to 80% of endocarditis is Streptococcus. 50 to 80% chances are there in case of Streptococcus is causing the endocarditis. So okay, what about the other organism, that is Staphylococcus? Staphylococcus, this organism can cause 20 to 30% chances are there to cause endocarditis. So Streptococcus and Staphylococcus, these two organisms are the one which is causing endocarditis. Among these two organisms, all are bacteria only. Okay, among these two organisms, which is mostly causing this endocarditis, 50 to 80% Streptococcus. Okay, fine. And what about all other options? E. coli, Pseudomonas, Klebsiella. E. coli is a normal flora which is present in the intestine. Obviously, if it is going excess and the person is immunosuppressant, means even the E. coli will also cause problem in the patient. Okay, and what are all the other golden points you should remember when you come across endocarditis? The clinical manifestations, that is, in case of endocarditis, skin lesions will be there. Skin lesions. What are all those skin lesions? Two skin lesions you have to remember. This is the classical manifestation. What is that? Osler nodes and Janway lesion. Okay, Osler nodes and Janway lesion. These two things you have to remember. So what is Osler nodes? It is very simple. Lesions, tender lesions. Tender means a painful lesion. It is present or found in the fingers. The lesion found in the fingers. Okay, so you know what is lesions, right? Fine. The next one is Janway lesion. Janway lesion means papules. Papules are a small cyst-like elevation less than 1 millimeter, which is seen in the palms and soles. Where you can see palm and soles. Understand, guys? Yes, so these two skin lesion you have to remember: Osler nodes and Janway lesion. Osler nodes means in the lesion which is seen in the fingers. Janway means papules which is seen in the palms and soles. Okay, so what are all the other golden points you're supposed to remember when you come across endocarditis? most common area which is getting affected in the endocardium. See, endocardium is attached with the walls of the heart, right? So walls of the heart are more commonly getting affected. That is tricuspid valve, bicuspid valves. These valves are more commonly affected. The vegetation means what? Growth of the bacteria is taking place in the walls of the endocardium. Okay, okay, fine. So all the patients will get this disease. See, if the person immune power is less, so they are prone for this disease. Apart from that, pre-existing heart disease like rheumatic heart disease, okay, otherwise degenerative heart disease like mitral valve prolapse or any other valve disorders, okay, even cardiac procedures if they already undergone like placement of any artificial valves or pacemaker, okay, pacemaker or prosthetic valves, that is artificial valve, prosthetic valves, okay. So if the person underwent any these procedures or already having congenital disorder like mitral valve prolapse or already the person exposed to rheumatic heart disease, so these persons are more risk for getting the endocarditis. Okay guys, so these are all the golden points you supposed to remember when you come across the word endocarditis. See, in a single word, what are all the golden points you have to remember? You know, all these points has to come into your mind in order to solve this question very easily. Understand guys? Fine. The next question what we are going to discuss is signs and symptom of hemorrhagic and septic shock. So here they have given four options: hypotension bradycardia, hypotension tachycardia, hypertension tachycardia, hypertension bradycardia. So these are all the four options. So first you should know about hemorrhagic and septic shock. What will happen in hemorrhagic? From the word itself easily we can see or say hemorrhagic means because of loss of blood, because of any reason like trauma, okay, there is a loss of blood, immediately what is happening, okay. And septic shock means immediately you have to think about vasodilatation. Understand? Vasodilatation. Fine. So in case of vasodilatation, what will happen? The blood pressure will increase or decrease. The blood pressure will decrease. That is called as hypotension. If the blood pressure is decreased, immediately in order to compensate that, what will happen? The heart will start to beat very fast. Okay. That situation is called as tachycardia. So what is happening in the septic shock? First, what is happening? Vasodilatation. This is the golden word. So once you come across the word vasodilatation, automatically the next step it will come into your mind. So because of vasodilatation, what will happen? The blood pressure will drop, right? So once the blood pressure is dropped, that condition is called as, that word is called as hypotension. In order to compensate the hypotension, what changes will be there in the body? Tachycardia. Understand? So here what is happening? Tachycardia is there. So two options, tachycardia is there. Fine. So we have scrutinized the options. So A is the wrong one and D is the wrong one. Fine. Because tachycardia is present in only two options. Okay, fine. Let's move on to the hemorrhagic. Okay. In hemorrhagic, what is happening? Because of bleeding, okay, loss of blood. So again hypotension is there, okay, again tachycardia is there. So in both of the thing which is very common, hypotension tachycardia. So which is going to be the right answer? Hypotension tachycardia. The option B is the right one. Which is the right one? Option B is going to be the right one. So this is the rationale behind the question. Hope you understand this one. So option B is the right one. Okay guys, now we are going to discuss about abruptio placenta. This abruptio placenta is also called as placental abruption, placental abruption. So let's see the golden points, because I doesn't receive the, or I doesn't get the options. So we are going to discuss the golden points here. Okay, so abruptio placenta is also called as placental abruption. It means premature separation of the placenta. What's separation? Premature separation of the placenta. This is the first meaning of the abruptio placenta. The second thing you're supposed to remember is in which time or which week of gestation it will happen. Around 25th week of gestation, this premature separation of placenta will take place. This is the second golden point. Okay, fine. So the placental separation happened. So what will be the manifestations? That is the third golden point. Vaginal bleeding, lower abdominal pain, dangerously low blood pressure. So these are all the three golden signs of the abruptio placenta. Fine. See, this is the fetus here and this is the placenta. So what happened? This placenta got separated. So bleeding is taking place. Either it might be an internal bleeding or external bleeding. Okay, that doesn't matter, but bleeding is happening. So once there is a bleeding, what will happen? Blood pressure is going to get down. Right? So dangerously low blood pressure will be there. And what about the bleeding? Painful bleeding will be there. Vaginal bleeding is going to be painful. Many students are making mistake in this. In placenta previa, painless bleeding will be there. In placenta previa, painless vaginal bleeding, and in abruptio placenta, painful vaginal bleeding. Painful vaginal bleeding will be there. Understand? Fine. So these are all the important golden points in this slide. See, now we are going to see the difference between the normal placenta, placenta abruption and placenta previa. As I mentioned already, many students are having confusion between abruptio placenta and placenta previa. How to remember this? How to remember the placenta previa? See, previa means front. So you can remember the word front. Okay, front means what? Previa. That is previous. Something is present in the front. That is called as what? Placenta previa. So what is present in the front? Placenta is present in the front. Okay. See, there are three types of placenta previa. The first one is total placenta previa. Next, partial placenta previa. And next one is marginal placenta previa. Total means you can see in this picture, this is the total placenta previa. Total blocking of the outlet. Okay, and partial placenta previa means you can see from here to here, partial blockage of the outlet. This is partial placenta previa. Marginal placenta previa means it will be here, near to the outlet. Okay, so these are all the three types of placenta previa. The main important MCQ what they have asked here is, they will ask what is placenta previa. Otherwise, second, types. From the types they will ask the questions. And third is bleeding. Most commonly asked question till now is bleeding, vaginal bleeding. Here in placenta previa, painless vaginal bleeding will be there. How the bleeding will be? The bleeding is going to be painless. The bleeding is going to be what? Painless. One sec. Okay. Painless. Okay. Whereas in abruptio placenta, painful bleeding will be there. Painful bleeding. Fine. So this is the very important MCQ till now they asked in many exams. Okay, so remember this one. Let's see the risk factors now, because that is also very important. See, here you can see both the disease conditions, whether it is a abruptio placenta or placenta previa, we can identify by means of using the ultrasound. What we are going to use? We are going to use the ultrasound in order to find out whether the person is suffering from abruptio placenta or placenta previa. Okay, fine. So as I mentioned already, in abruptio placenta, what is there? painful vaginal bleeding. In placenta previa, painless vaginal bleeding. Painless vaginal bleeding is there. Okay, so what are all the risk factors of placenta abruption? This is a very important golden point. That is hypertension, cocaine use, trauma, and multiparity. Multiparity. Many times the pregnancy is apparent. And what about in placenta previa? Prior C-section, that is cesarean section, multiple gestation, multiple induced abortion, advanced maternity age. Okay, so these are all the point you should remember when you come across the word placenta previa and abruptio placenta. The next question is, the patient on furosemide, which diet is preferred? See, furosemide is a loop diuretic. You know, if you administer loop diuretic, the main problem, the main side effect is electrolyte loss. Electrolyte loss. All the electrolyte will be lost. Even sodium, potassium, everything is going to get lost. See, here in this situation, as a nurse, we have to focus on which type of diet. That is the question. Which diet is preferred for the patient who is having or who is taking the furosemide? This is the question. As I mentioned already, all the electrolyte is lost. Even the sodium and potassium is the main electrolyte that is going to get lost. So, sodium level is 135 to 145 milliequals per liter and potassium 3.5 to 4.5. Some book says 5 or some book says 5.5 milliequals per liter. So, why I am saying this is the sodium level is normal value is high 135 to 145, whereas the potassium value is very less, that is 3.5 to 5 milliequals. Fine. So when compared to sodium, the potassium level is very less, so you have to concentrate more on the potassium. Already the potassium is very less, the normal value is very less in our body. Again, this normal potassium is going out, this minimal potassium is going out, means what will happen to the vital organs? See, all the vital organs, it required what? Potassium, especially the heart. If the potassium is not there adequately, then arrhythmias will take place. Understand? So, when compared to sodium, where we have to insist more? Which diet we have to insist more? Potassium rich diet we have to insist more. Understand? So, that is a first golden point here. Second, I said sodium is also going out because of furosemide. So, why we need to give low sodium and high potassium diet? Low sodium and high potassium diet is mentioned in the answer, right? So why we need to do that? So we understand the rationale behind high potassium, right? Why low sodium? See, low to normal sodium we can give to the patient. If you are giving high sodium, the sodium is going to suppress. The sodium is going to suppress the potassium. That's why low sodium to normal sodium diet we can give, but high potassium diet has to be administered to the patient who is undergoing furosemide. So this is the rationale behind that. Okay guys. The next direct question is, target of maternal mortality rate by 2030, and the answer is 70 per 1 lakh live birth. 70 per 1 lakh live birth. This is a direct question, so there will not be any rationale behind this. The next question what we are going to see is suprapubic angle in gynecoid pelvis. 4 options they have given here: 45, 90, 100 and 60. So suprapubic angle, where is the suprapubic angle? You can see this is the pubic region, this is the pubic bone, this is the pubic bone. Okay, and this area is called as what? Suprapubic angle. Suprapubic angle. And in the question they are asking suprapubic angle in gynecoid pelvis. And in this image, two image is differentiated, that is male pelvis and female pelvis. Male pelvis is also called as android pelvis and female pelvis is also called as gynecoid pelvis. In this pelvis, we are going to focus on the suprapubic angle. Suprapubic angle. Fine. Okay. So here you can see the suprapubic angle of the android pelvis is 60 to 70 degree. 60 to 70 degree. Whereas the suprapubic angle of the gynecoid pelvis is 80 to 90 degree. It is very clearly mentioned and differentiated in this image. Okay, so in gynecoid pelvis the suprapubic angle is 80 to 90 degree. So we are selecting the option B, that is 90 degree. Understand guys? In case if they are asking android pelvis or male pelvis, in that situation what will be the answer? The answer is going to be 60. Answer is going to be what? 60. Understand guys? Fine. The next question is, total IV fluid to be infused is 2000 ml in 24 hours. In 24 hours. The drop factor is 15. Calculate drop per minute. So this is the question. Now we have to scrutinize the important keywords. What are all the keywords? Total IV fluids to be infused is 2000 ml. How much? 2000 ml in 24 hours. And drop factor is 15. So these are all the three keywords. So we know the formula already for the IV fluids, that is volume in ml per minutes into drop factor is equal to flow rate. Okay, so if we are substituting the values here, we will be getting the flow rate. Okay, GDT means drops per minute. Let's substitute. So volume, what is the volume they have asked here? 2000 ml. So we can substitute 2000 here. And what about the minutes? 24 hours. They have mentioned in hours. We have to convert this hours into minutes. How to convert the hours into minutes? 24 into 60. 24 into 60 because each hour carries 60 minutes, right? So 24 into 60. Okay, we have to add 60 here. Into drop factor. They have clearly given the drop factor 15. Okay, so 2000 ml divided by 24 into 60 into 15. Okay, so if you are substituting all the values, calculating, then you are getting what? 20.83. So in your options, anywhere which is related to 20, so that is the right option. Hereby I am ending the part 2. Soon we will be releasing the part 3. Okay, so if you have any difficulty in understanding, please comment in the comment section. And please follow us in Meteor Nursing Academy YouTube channel. Share the video as much as possible so that everyone will get benefited from this. And if you want to contact us, you can contact us in the given phone number and mail ID. Thank you guys.